Herbs for feverish states of children. Fever occurs when the body temperature rises above normal. The average normal body temperature taken in the mouth is 37 degrees Celsius, but anywhere between 36.5 degrees Celsius and 37.2 degrees Celsius is deemed as normal. When temperatures are measured in the axilla, they can be 0.2 degrees Celsius to 0.3 degrees Celsius lower than this. Oral, tympanic, thermometers may measure the temperature as higher. The cause of the fever can sometimes be hard to elicit, and this can be a worry for healthcare professionals. It is usually due to a viral infection that is self-limiting, but it can also be a sign of serious bacterial infection, including meningitis. Early diagnosis of serious infections in general practice is difficult as incidence is low. The child may present early in the disease process, and diagnostic tools are more or less limited to history and examination. Children typically fall ill and recover quickly. The main worry in acute illness is controlling fever and keeping the temperature below 39 degrees Celsius. Children with fevers approaching this level, and above, need medical attention. Fever is one of the most common reasons for a child to be taken to see a doctor and is the second most common reason for a child to be admitted to hospital. The former can be safely treated with herbal remedies, while the latter needs professional advice and treatment. Herbs for feverish states of children. 1. Meadowsweet. Botanical name, Filipendula ulmaria. Aspirin-like substances were first isolated in the 19th century from meadowsweet. The herb has some of the characteristic properties of aspirin, notably a mild anti-inflammatory activity, but unlike aspirin, meadowsweet is a key remedy for healing acid-related problems such as heartburn and gastric ulcer. Part used, flowering top. Actions: Antacid, Anti-inflammatory, Antirheumatic, Astringent. Best taken as infusion, tincture. One of the best remedies for acidic digestive problems, meadowsweet promotes stomach repair while controlling acid release. Taken symptomatically, meadowsweet tea relieves mild heartburn or acid reflux, although for best results, meadowsweet may need to be taken long-term. The herb's astringent, binding quality makes it a useful treatment for chronic diarrhea and irritable bowel. Meadowsweet can bring relief to stiff, sore, and aching muscles and joints, soothing inflammation and stimulating clearance of acid residues. Where symptoms get worse on waking or sitting for long periods, combine it with celery seed, Opium graveolens, in order to ease inflammation and aid free movement. Dosage for adult, 5 to 15 grams a day, or 100 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 rod the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: contains aspirin-like substances. If allergic to aspirin, do not use. Can cause gastrointestinal upset. 2. Elderflower. Botanical name, Sambucus nigra. Although poorly researched, elder is a safe and effective domestic remedy for ear, nose, and throat problems, whose traditional use in Europe goes back to pre-classical times. The remy white flowers are often collected to make wine, but the tincture or hot infusion are therapeutically more effective. Parts used: flower, fruit. Actions: Anticatarrhal, anti-inflammatory, antioxidant, antiviral, diaphoretic, stimulates sweating. Best taken as infusion, tincture of flower, tincture, extract of fruit. Elderflowers make an excellent cooling infusion for cold symptoms, flu-like colds, and mild feverish states by easing symptoms as well as countering infection. They combine well with yarrow, Acalium mellifolium. Drink the infusion hot, sweetened with honey. Ripe elderberries contain high levels of vitamin C, and contain strong antioxidants. Take elderberry syrup or extract to counter infection and speed recovery. A recent clinical trial found that elderberry extract shortened recovery time in people suffering from influenza. In either form, the berries can be taken to improve resistance to infection and reduce a tendency toward recurring colds, sore throats, and coughs. Elderberry extract is available as an over-the-counter remedy, and can safely be given to children. Elderflowers can dry and tone mucous membranes lining the nose and throat, reducing sneezing, itchiness, and a runny nose in conditions such as allergic rhinitis and hay fever. Combining elderflowers with nettle, Rhodoca dioica, is more effective in such cases. Elderflowers are often used in chronic catarrhal problems affecting the sinuses and the middle ear. In combination with other remedies, the flowers are also useful in treating chest infections such as bronchitis and pleurisy. Elderflower tea, taken hot rather than cold, is thought to act as a diuretic, stimulating urine flow. It is traditionally taken to relieve rheumatic aches and pains. A cold elderflower infusion can be used as a wash for sore and inflamed eyes, including conjunctivitis. Mildly astringent, it is believed to relieve skin conditions such as acne, eczema, and psoriasis. Dosage for adult, 5 to 15 grams a day, or 100 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 rod the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions, none known. 3. Limeflowers. Botanical name, Tilia spp. Commonly planted in gardens and parks, the lime or linden tree bears flowers that perfume the air on summer evenings. The delicate scent acts much in the same way as the infusion made from the flowers, soothing troubled states of mind and relieving tension headaches, migraines, and sinus congestion. Part used, flower. Actions, antispasmodic, diaphoretic, mild sedative, nerve tonic. Best taken as infusion. Limeflower is considered to be an excellent remedy for head colds and mild fevers, as well as nasal or sinus catarrh. Drink small amounts of limeflower tea frequently throughout the day. It is an excellent remedy for children, and can be blended with some apple juice in order to improve the taste. The tea also makes a good steam inhalation to ease sinus headache and congestion. Limeflower combines well with elderflower, Sambucus nigra. Underappreciated, perhaps because it is a gentle-acting remedy, limeflower has constituents that exert a mild tranquilizing effect, similar in some respects to benzodiazepine tranquilizers, for example, Xanax or Valium. Usually best taken as an infusion or tincture, limeflower helps to cool and relieve anxiety states, particularly when symptoms include head and neck tension, palpitations, and feeling hot and bothered. Its mild action makes it valuable in helping to soothe agitation and restlessness in children, and it can also be taken to calm emotional shock, combining well here with oat straw, Avena sativa. A good nighttime drink, limeflower tea is safe for children and adults alike, encouraging relaxation and a drift into sleep rather than being overly sedative. Combine with passion flower, Passiflora incarnata, to increase the sedative strength of the tea. For nervous tension and to aid sleep, 50 to 300 grams, 2 to 10 ounces, of flowers can be infused for 20 minutes in the evening and added to a warm bath. Relax and soak in the bath, then retire to bed. Specifically used for nervous palpitations, the flowers are thought to slow and stabilize the heart rate and rhythm and are often prescribed by herbal practitioners for an irregular or a racing heartbeat. Limeflower can also be valuable as part of a broad approach to treating high blood pressure, especially where this is associated with arteriosclerosis, hardening of the arteries, and nervous tension. Taken long-term, Limeflower's high bioflavonoid content helps to improve the health of the arteries, and the flowers combine particularly well with hawthorn to support healthy heart function and circulation. Limeflower stimulates blood flow to the capillaries and surface of the body, thereby stimulating sweating and helping to cool the body in hot and feverish states. When combined with circulatory stimulants such as ginkgo, ginkgo biloba, or angelica, Angelica archangelica, this circulatory effect can help to improve peripheral circulation and a tendency to cold extremities. Conditions such as chilblains and restless legs can also benefit. Dosage for adult, 3 to 7.5 grams a day, or 50 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 rod the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: can occasionally cause allergic reactions. Pollen can provoke hay fever.